Today is a bittersweet day as I introduce the Jonah Bichotte Cowan bill, named after my late son in 2018. This bill requires hospitals and birthing centers to provide patients experiencing preterm labor with information regarding the potential health effects of preterm labor and preterm delivery on an expectant mother and her fetus, as well as care for mothers experiencing preterm labor. This bill is not only dedicated to all expected mothers with complications, but it also includes, but not limited to, highlighting the obvious health disparities regarding Black mortality, maternity, and Black infant mortality rates. For years, Black women have been experiencing these disparities firsthand. The care we receive, or rather the care we do not receive, during pregnancy and childbirth can lead to the death of a mother and child. In New York City, Black women are estimated to be up to 12 times more likely to die during pregnancy and childbirth than white women, and are 3 times more likely to suffer from life-threatening complications. It is also found that college-educated Black mothers experience severe complications at higher rates than white women who lack a high school diploma. A study published by Black Women Birthing Justice, which surveyed Black mothers in California from 2011 to 2015, found that Black mothers tended to have better health outcomes when they had a good relationship with their caregivers. Oftentimes, this meant that Black women who utilized doulas or other non-traditional medical professionals tended to have better health outcomes for themselves and their children. The impact of the stress of racism can be seen in a report which revealed that Black women face higher infant death rates when in their 20s rather than their teens. For white women, the rates are opposite, with lower infant death rates in their 20s versus their teens. Even more alarming than statistics on preterm labor is the fact that despite the availability of new medical technologies and modern techniques, racial disparities are wider now than in 1850, before the end of slavery. Black infants in America are now more than twice as likely to die as white infants. Unfortunately, Mr. Speaker, my baby, Jonah Bichotte Cowan, is one of those statistics. In October 2016, I was 5.5 months pregnant. And when I went to my doctor at Columbia University Medical Center, they told me I was 3.5 centimeters dilated. I had something called incompetent cervix. I had to rush to New York Presbyterian Columbia University Hospital, where my doctor and her team, when I got there, it was informed to me that my baby was bulging out. They gave me 2 options: to either terminate my pregnancy or to leave the hospital and go elsewhere. The doctor and the resident at Columbia Medical Center said that because of hospital policies, there was no room for me if I wish not to terminate my child. They also indicated that I needed to leave because they needed the room for another patient. I didn't want to leave. Why? Because my unborn son and I were in incredible, fatal, and high-risk situation. But we're not allowed the safe care of medical professionals because of a hospital policy. A policy which claimed that they could not intervene before 23 weeks because the insurance would not cover my preterm labor care. I was 1 week away from receiving the care we desperately needed. Just imagine what I was going through and what the other Black pregnant woman down the hall who was crying immensely was going through, because she too was losing her baby. So after crying like crazy and not having control, I had my friends, Haitian doctors from the American Medical Haitian Association physician, who called the doctors and informed them that it was illegal to kick me out and that they should admit me and monitor me. They refused. So at that point, we had no choice. We left because they pushed us out. It was arranged by these Haitian doctors for me to go to Wyckoff Hospital in Brooklyn, where immediately the doctors there did everything they can do to save my baby and save me from dying. After several days, I delivered my son, Jonah Bichotte Cowan, but he didn't survive more than 2 hours. He was deemed a stillbirth. Because of what happened to me and so many women, I decided to introduce the Jonah Bichotte Cowan law after my deceased son, which ensures that patients experiencing preterm labor are informed of preterm labor risk and requires hospitals to take care for women with high-risk pregnancy. Not Blacks only, not whites only, not Hispanics only, not Asians only, all women with equity. And in April, preterm labor accounts for 17% of all infant deaths in America. No pregnant woman should be turned away from a hospital during preterm labor. Earlier this month in my borough, Brooklyn, Sha'Asia Washington became the third Black woman in New York City to die from birth-related complications so far this year. Family members eager to meet the newest member of their family texted Sha'Asia to call them when the baby was born. Unfortunately, that call never came. Sha'Asia died shortly after birthing her baby. She was only 26 years old. And in April, another 26-year-old pregnant Black woman, Amber Rose Isaac, died at Montefiore Hospital after tweeting about dealing with incompetent doctors. She died alone as New York City battled the coronavirus. Mr. Speaker, this is why I have created this supporting legislation, which would finally level the playing field so that all mothers can enjoy the experience of pregnancy and birth of their children. I want to first thank the members of the Haitian American Physician IMHE, Dr. Leslie Kanisan, who called the doctors at Columbia and gave them a piece of his mind and coordinated a rescue plan for me. I want to thank Dr. Daniel Faustin, who himself and all the doctors and the nurses at Wyckoff helped me, who helped deliver my child, Jonah Bichotte Cowan. I also want to thank the advocates like Baby Resource Center, Star Legacy Foundation, March of Dimes, and other institutions in New York City, health and hospitals, and SUNY Downstate, who are trying very hard to change their approach for better outcomes in our community. Today, Mr. Speaker, I stand with this bill, Jonah Bichotte Cowan, for all the Black maternal women who lost their lives, and for all those Black infants who lost their lives due to discrimination, injustice, and negligence. I call on all their names. And lastly, Mr. Speaker, I ask my colleagues to join me in passing this legislation. In memory of my son, Jonah Bichotte Cowan, I'm thinking about you every day, and I thank you for giving me the strength to do this for all women, so that they don't have to go through what I went through and what you went through. So I thank you. I thank you, Mr. Speaker. I will be voting in the affirmative, and I encourage all my colleagues to do the same.